The following program is a paid advertisement. The views reflected on this show are not necessarily the views of ESPN 1000.
Doctor? 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 Doctor?
Doctor?
Doctor?
Doctor?
You're listening to Sports Medicine Weekly with Steve Kashul and Dr. Brian Cole on ESPN 1000.
Sports Medicine Weekly being brought to you by Midwest Associates, the number one choice for advanced orthopedic solutions, innovative products, and superior customer service. By Accelerated Rehabilitation Centers, putting patients first. By Theratech Equipment, a winning team for fast and complete recovery. By Midtown Athletic Club Oak Park, your place for small group fitness and sports performance training. And by Midwest Orthopedics at Rush, team physicians of the Chicago Bulls, White Sox, and DePaul University Athletics. Good morning, everyone. Welcome to Sports Medicine Weekly. My name is Steve Kashul, radio host of the Chicago Bulls. Soon I'll be joined by my co-host, Dr. Brian Cole, the head team physician for the Chicago Bulls and sports medicine specialist from Midwest Orthopedics at Rush and Rush University Medical Center. Thanks for joining us. We come your way each and every Saturday morning at 8:30, helping you with your sports medicine injuries and all the hot topics going on in sports medicine. So stay with us. Back to get it going right after this on ESPN Radio.
The Chicago Bulls, White Sox, and DePaul Blue Demons rely on Midwest Orthopedics at Rush for advanced orthopedic treatment. So can you. We are the team physicians for these Chicago teams, and we're ready to be on your healthcare team too. Get expert care from these regional leaders at 4 Chicagoland locations. Learn more at rushortho.com. Midwest Orthopedics at Rush, your world-class team physicians. Do you face orthopedic surgery for a sports or work-related injury? Theratech Equipment is Chicagoland's trusted leader in providing continuous passive motion for home use. Theratech will demonstrate how you can have a speedier, less painful recovery using a CPM device delivered right to your home. Theratech Equipment, your winning team for fast, complete recovery. Visit homecpm.com.
You're listening to Sports Medicine Weekly on ESPN 1000.
And we're back on this Saturday morning. Steve Kashul with Dr. Brian Cole. Our show is Sports Medicine Weekly, and net proceeds from this show, Sports Medicine Weekly, go to support orthopedic research at Rush through the LiveActiveNow.org fund. Our producer is Peter Cohen. Treesan Seeger, our coordinating producer, sets up all the guests, does a wonderful job. Treesan, wonderful, wonderful work. Dr. Cole, next question for you. CrossFit training. Do you do any of that?
I don't. I'm familiar with it, and I've never done a class, so I would not want to be critical in terms of the what it brings to the table. I see a lot of patients who do CrossFit, and they are just really, really into it. There's something much like we've talked about in the past. Say, what Dr. Mianis said last week about rugby. It's sort of an addicting sport. CrossFit seems to be hit some part of these people's physiology or nervous system that keeps them going. And I suspect it has to do with the fact that they're seeing results, and once they get over the hump, they don't want to stop doing it. I have a feeling there's sort of an upstart. It's very front loaded in terms of when people start doing it because it's relatively new in terms of the movement patterns. But then once they get into it, they probably just want to keep going. It's like a person who just starts exercising who just is afraid to stop because of what it was like before they exercised.
What kind of injuries do you see?
I'm seeing primarily, because my practice is shoulder, elbow, knee. I see more shoulder injuries, and primarily. I mean, and unfortunately, a lot of them are surgical. We're seeing they tend to be people who are in their 30s to, say, 45 age range who are getting into it, and they do something abruptly, maybe in the spirit of competition or not doing the progression in the proper way, like they're supposed to, and they're getting rotator cuff tears, they're getting labral tears, pretty bad injuries, to be honest. Bad defined as ones I can't get better without surgery. Now, I don't know what the denominator is, and we've done some research in CrossFit, and we remain slightly concerned. But I think if it's done correctly, it's probably a great form of organized exercise. But that's the big if, and when people are getting an organized exercise on a regular basis, and add that competitive aspect of it, and you add complexity, that's a formula for a prescription for the potential for a high incidence of injury.
Well, our guest in studio is Liz Yerly, who's with Accelerated Rehabilitation Centers, and she's in the South Loop. She also is the owner of Chicago Recovery Room, an open-to-the-public cutting-edge training facility designed to enhance recovery, prevent injuries, and improve performance. All right, Liz, thanks for being with us here on Sports Medicine Weekly. on this Saturday morning. CrossFit training. I'm thinking of multiple exercises within a certain time frame. What is CrossFit? Is it safe?
Yeah, so CrossFit is definitely a new fad. It's definitely all the hype is about CrossFit these days. It's essentially high-intensity interval training that incorporates Olympic lifting, powerlifting, components of gymnastics, and then basic calisthenics. So it's timed, and it's all about progression. So as Dr. Cole was alluding to, I think what people are excited about CrossFit is that it's results-oriented, and part of the routine is that you track your progress. So you're tracking it on a board, you're tracking it in front of your classmates that you're seeing on a regular basis. So there's definitely a competitive nature to it, which is also, I think, what leads to the injury part.
What are they tracking?
So you're tracking your reps. Everything's counted in generally reps or time. So how fast did you do something? How many reps did you do? And how much did you lift? And that's where that equation can get a little bit sticky in terms of injuries.
But you mentioned time. Are these 30-minute workouts? Are they 45, 60-minute workouts?
No, they're fast. So generally, a CrossFit routine consists of showing up and you do either an Olympic lift or a power lift, so some type of...
Before a warm-up, or is that the warm-up?
No, you're going to do a warm-up. So you do some kind of little warm-up. They do a lot of rowing, using airdynes, running, general warm-up, and then you do Olympic lifting. So that might be a snatch, a clean, and then you do power lifting, a squat, a front squat, a bench press. So you start with that, and that's controlled and it's monitored by the coach, and you're either doing a 3-rep max, a 1-rep max, or you're just doing it like 3 sets of 5. It kind of depends on the programming. Individually
or mostly as a group?
You're definitely as a group. So okay. A lot of CrossFit depends on, the facility you go to, what the group sizes look like, how many coaches there are to members that are there. And then once you do that kind of lifting component, you do some type of WOD, it's called, the workout of the day, which consists of that more kind of high-intensity training. So a combination of maybe a gymnastics move. It might incorporate a lower weight Olympic lift, a calisthenic, a plyometric, and you're doing that... they call them AMRAPs, as many reps as possible in a certain time frame, or you're doing it every minute on the minute. There's various kind of types of that kind of more.
Here's where I see the pitfalls. Number one, part of it involves is there a maximum weight thing?
They have what is called a prescribed weight, so they do a recommended weight that they say for women and men, but then you scale it. Like, I very rarely work out at the recommended weight. It's too heavy for me.
All right, so then you take the person who doesn't have as much sense as you do. And then you mentioned the as many reps as possible, which inevitably, especially if you're going against someone else and then you're tracking that as one of your outcomes, right?
Yep.
Then you're dealing with fatigue, and I can tell you categorically that's when I see injuries in high-level sports is when there's a fatigue component, and then they start, their form is bad because they're just trying to get their reps. I mean, you have to educate me, and again, I don't want to be unfairly critical because I should just go and see. But if you were putting it on paper and describing it to me, it's worrisome. I mean, this recent article published in Journal of it was the Journal of
Sports Medicine.
Journal of Sports Medicine cited a 20% injury rate. Now, running has a high injury rate too, but I don't operate on runners.
That is
true. I rarely do. But they can have injuries that are plaguing, they're overused, they can get stress fractures, all kinds of stuff. And I see plenty of running injuries. But generally, we can get them back, and they can scale back. How can you take a 35-year-old who's never done a clean and jerk or a snatch of these things, and you're telling him to start doing this, and then you're going to maximal rep out? And I mean, it seems counterintuitive to me.
Yeah, definitely. There's definitely...
It just isn't. It can't be for everyone. That's the thing, right? I mean...
Yeah, this is all true. I think that it really matters. I mean, I think where people get into trouble is your ego.
That's a big driver. That's why we.
Absolutely.
It's a good bad thing.
And that's what It's the good, the
More
bad.
More men
and the
than
ugly.
women?
Maybe. I don't know the statistics on that.
What do you see at Accelerated?
At my place. Oh, in terms of injuries?
Yeah.
Men are injured. In this last research study, men are injured more frequently than women are.
Why?
Controlling for the numbers that are there?
That's what they... I'd have to look a little more closely, but I believe so.
I mean, I see a fair number of instructors, and that's why I got to be careful. I'd be too critical because these are good guys, and they're in monster good shape. I mean, some of the most fit people that I take care of are doing CrossFit. I don't worry so much about them. It's all the people in between who see, hey, this is a quick way for me to get in shape. It's efficient. I don't. So what are you seeing at Accelerated?
Yeah, we're definitely, and I think that's what's alarming is the injuries are generally more catastrophic, let's say, right? You're seeing a torn labrum, a torn rotator cuff, a herniated disc, and so those injuries are generally maybe might plague you for a little bit longer in life, and they bring you to the OR. And so that's definitely absolutely a concern, and why it needs to be done well, and people need to be educated about it.
So what's the sales pitch? In other words, you've got this that has, at least in this article, 20%. We've shown higher injury rate of some rate, but then you've got just listen to our show. We've probably have 10 different individuals who are said experts in their field where they're not getting injured. So is the upside there that they wouldn't otherwise get? Is that the idea? I mean, is this so evolutionary that this should replace other forms of exercise? You can't achieve what you're achieving in CrossFit?
No, I mean, there's really nothing that new about CrossFit. That's what's funny about it, and that's why people make fun of it, is that, I mean, it started out as box, like garage workouts.
Right.
These facilities are
it's like
called
what I used to do in
boxes.
high school.
It's calisthenics, plyometrics. It's used a lot in the military. I mean, this is basic training, high intensity basic training is kind of what it is.
But has it taken on a life of its own, so to speak?
Totally.
I mean,
it's huge, Steve. It's
so
huge.
that's the thing that, I mean...
What did you think about my comments about why it's so big? I mean, I don't know what the percentage of people are getting into who have not been exposed to formal episodic exercise, where they do it at a frequency and they're committed. So I have no idea what the demographic is, but simply stated, why are people so addicted to it? What is it about it?
Yeah, I would say I think because it's results oriented, so you can tell a CrossFitter when they walk in, their body's just different. But I think more so, like for me at least, I got away from working out for a really long time, and I played group sports, so team sports, and I don't, as like a 34-year-old woman, like, I'm not going to really, I mean, you can, but I don't play team sports. So I liked the mentality of going and working out hard in a team. You're seeing the same people at regular time intervals. You have a coach. So it felt very more like camaraderie, community.
So
that's
a good aspect.
may be the driver.
And what about the response they get that they may not have gotten in other forms of exercise?
That's it, too. It's a little bit what you like. Like, I would rather shoot myself than run on a treadmill for 60 minutes. But if I can do anything for 30 seconds, if I'm going to get a rest in 30 seconds. So it depends on kind of the makeup of your body, what type of exercise you like to do.
Sounds like Steve's weekends. Sorry.
And you know what I was thinking of? I had a bad back for about 10 years. A ruptured disc, and so I'm very careful now. I don't do squats. I don't do any clean and jerk and any of these things. So I would stay away from those. I would say I'll pick the things I want to do because I'm still scared, and I've been healthy now. My back has been great for years and years, and I want it to stay that way. But I tailor my workouts to make sure that my back's protected. I don't do anything out of the ordinary.
Absolutely. I mean, you have to know your body. You have to understand limitations. When I started, I have terrible knees. I don't squat past 90. They recommend that. Most healthcare professionals would not agree with that recommendation. And so, you have to know, and that's where these guys run into trouble. You have to have a coach that understands limitations, previous medical history. So, I mean, although I love to speak on both ends of it, I see the dangers of CrossFit, but I like to work with that mentality, that athlete. So you kind of work within their goals as well to get them to doing what they like to do as safely as possible.
Liz Yerly, our guest from Accelerated Rehabilitation. And Accelerated, you guys will accept them, right?
We're happy to see you.
Yeah, that's good. And what separates you guys? Let's talk like a quick plug before we go away for a commercial break here. But at Accelerated, I know you've been there a while, and you really believe in the philosophy. What are you guys doing that's a little bit different?
I think Accelerated really invests in their therapists in terms of education. So for me, the driver is that anytime I want to explore something new, such as CrossFit, I mean, they'll sometimes even help you pay for a membership to try CrossFit so that you are getting in with those athletes. So, I mean, they care about their clinicians kind of being top-notch in terms of education, going to the courses that they like to go to. And our philosophy is that we're putting patients first. So, if that CrossFitter is coming in and they have a goal to go back to some form of CrossFit, we're going to put them, we're going to make that part of their treatment program.
Great stuff. Liz, appreciate you stopping in this morning.
Absolutely. Thanks for having me.
Liz Yerly from Accelerated Rehabilitation Centers in the South Loop. Talked a little about CrossFit. Interesting conversation. Back with more of our show, Sports Medicine Weekly, after this.
On ESPN Radio.
Sprain your ankle playing basketball? Back pain keeping you up at night? Suffered an injury on the job? At Accelerated Physical Therapy, we can help. We are a Chicago-based physical therapy company that specializes in post-surgical ailments, workers' compensation rehab, and regular old aches and pains. We are committed to returning our patients to better health and dedicated to providing the best patient experience possible. For more information or to schedule a free injury screen with an Accelerated Physical Therapist, contact 800-474-8300 or visit acceleratedrehab.com. Free injury screen not for federally funded payers. feeling tired, sluggish, and overweight? If you're looking to lose weight and gain energy, join us in Karen Malkin's 14-day Transformation Fall Cleanse. You're going to absolutely love this Whole Foods cleanse. You'll feel great, lose weight, build lean muscle, improve sleep, boost metabolism, and enhance athletic performance. This VIP done-for-you cleanse comes with a 14-day Transformation Wellness Bag containing MCT Lean Vegan Protein Blend, fat-burning MCT Lean MCT Oil, snacks, superfoods, recipes, guidelines, videos, and other surprises. You will absolutely love this program. Sign up at 14daytransformation.com. That's the numbers 14daytransformation.com, or visit Karen's website at karenmalkin.com. That's KarenMalkin.com. This pre-holiday cleanse starts any Monday of your choice through December 10th. Integrated Orthopedics is Chicagoland and Northwest Indiana's premier provider of thermal and compression therapy devices for people recovering from sports-related injuries or orthopedic surgical procedures. To learn more about the benefits of thermal and compression therapy and to determine if it's right for you, please contact your healthcare professional. For further information about Integrated Orthopedics products and services, please contact us at 773-248-6400. That's 773-248-6400.
You're listening to Sports Medicine Weekly on ESPN 1000.
Welcome back, everyone, on this Saturday morning Sports Medicine Weekly. I'm Steve Kashul with Dr. Brian Cole, and feel free to reach us on Facebook. smwhome.net is the website, and our Twitter account as well. You can follow us on Twitter at smwhome. Dr. Cole, I see you working out at the United Center sometimes, various places. You like to do a little strength training. Where did you learn your routine, or did you just develop it yourself?
Well, the interesting thing is that if you sort of look around the block and you see what people are doing, so I get to the games about an hour and a half, 2 hours before, so there's always about an hour to kill. So I try to get it done there, at least, the games I'm there covering. And even the guys in the training room, you see a lot of the strength and conditioning is done with body weight and or very low weights. What's fascinating is that, at least from my observation, a lot of the evolution has been using less, not more, even to the point where you're just using your body, bars, position, cables, bands, things of that nature. That still qualify as strength and conditioning. So it's probably gotten less technical than more technical, at least the things that I've been doing. And a lot of the stuff that I do now I've learned from trainers, quite frankly, that are really thoughtful, they're innovative, and it keeps it from getting boring. And less the standard, weights and high repetition or low repetitions, high weight, things like that. That, for me anyway, has changed a lot, mostly because of the education I've been getting from the people I work with. But it's always interesting to see what's out there and learn some of the new techniques that are available and things that may make a bigger impact for either less energy or more efficient, which we're all looking for.
Well, we got a great guest on the line with us, Sean Hyson, training director for Men's Fitness and Muscle and Fitness magazines and the author of a book called The Truth About Strength Training. Sean, thanks so much for joining us. He's in New York, and tell us about your workouts, Sean, if you will. Why do people believe that they have to work out to the point of exhaustion, pain, or even vomiting? Is that the case that some people believe, do you think?
Well, thanks for having me, guys. I think the problem is the fitness culture today is heavily influenced by CrossFit, mixed martial arts, TV shows like The Biggest Loser, and these things have people thinking that they need to brutalize themselves with exercise to see results, and you don't. I mean, the kind of workout that's attention-getting and makes for the best TV ratings isn't necessarily the best approach for changing your body, and it certainly isn't the best for people who have very little experience with exercise.
It's interesting that you say that because I can tell you in the office in any given week, probably the biggest injuries I see are what you just described, because there's all these opportunities for these highly competitive environments, and people sort of get lost in that, gets very competitive, and they're not really prepared to do some of the complex exercises at the weights and at levels that they're doing it at. So you might be onto something. So give us an example of what are some of the things that you're teaching.
Well, my book really takes a minimalist approach. It's the techniques that I've found to be effective from editing fitness magazines for more than a decade now. I've talked to all the best trainers and coaches in the world, and I know what they do, and the common ground with all of it is relatively low volume, and what you were saying in the beginning about getting back to body weight as much as possible, keeping the movement simple. You don't need to have more than 5 or 6 exercises in a workout, and focus on progressive overload. It's about doing a little bit more than you did last time. If you set the bar too high in the beginning, if you go in and do a workout where you're just doing a ton of volume, a lot of sets, a lot of reps, where do you go from there? You've already set the bar so high. How are you going to progress? So you need to keep it kind of on the low side to begin with. You can always add more work as you go.
Sean Heisen is our guest, training director for Men's Fitness and Muscle and Fitness magazines. I want to start from the beginning, Sean. I was reading a little bit on your website, Sean Heisen, Hyson. Sean is SEAN, SEANHYSON.com. Some of your pre-routines, like warming up the rotator cuff and actually holding on to an ice pack for 1 to 2 minutes before lifting. Tell us, if you can, to our listeners, and Dr. Cole and myself will enjoy some strength and conditioning as well, the proper warm-up routine. What do you suggest?
Well, yeah, you want to do what's called a dynamic warm-up or a mobility warm-up before you lift weights. The idea is just to get blood moving through the muscles, lubricate the joints a little bit, and you just want to take your muscles through the range of motion they're going to use in your workout. So if you're going to do a squat workout, a leg workout, you can do some body weight lunges first. You can do some leg swings. You just want to get blood flowing through you and get your body used to moving in patterns that you're going to use in the actual exercise that you're going to perform. And as far as that ice pack thing, that was just a strategy to get stronger right away. When you hold ice in your hands, it has an effect on the central nervous system. It allows you to recruit more muscle fibers and lift heavier weights.
So I confess I haven't read your book, but is the premise that it's one program can meet most people's needs, or does it sort of let the reader kind of figure out, hey, this makes sense for me, and they can do it on their own without much outside assistance?
The book is both theory and practice. I give you kind of my overarching philosophy of training, lots of ideas that you can use to incorporate in your own workouts, but I also give a 12-week workout and diet plan so you can have it all laid out for you if you like. And yeah, the idea is to keep it minimalist, and really any routine, any good solid weight training routine will get you bigger or get you leaner depending on how you eat for it. The diet controls whether your body weight goes up and down, whether you grow big muscles, whether you get leaner and more defined. So it's a myth that you have to have a specifically tailored workout to one of those goals or the other.
You know, a lot of the workouts now emphasize, well, look, if you're not going to do a ton of cardio or breakout cardio, the workout itself will keep your heart rate up, and that in and of itself is an efficient way to work out, and that's actually cardio. So I know you have some interesting ideas in your thinking. Tell us a little bit about that, how rest factors in, and, you know, do we have to keep our heart rate up the whole time? And, you know, most of us who are very busy are looking for really efficient ways to get it done. Can you just sort of give it to me in a nutshell what your philosophy is?
Yeah, I'm actually not a fan of trying to keep the heart rate up throughout the workout. The basic reason is this. If you talk to any good personal trainer, they're going to tell you that the most important thing you can do in a workout is to use good form on your exercises, right? Now, if we do a lot of reps and we don't rest much between sets, what's going to happen to our form? It's going to break down, and we're going to get hurt. And at the very least, we're not going to get the full benefit of the exercise. So I would rather people rest a little bit longer, do all their exercises with crisp technique, and they get the fat loss from their diet. It's a lot easier, too. It's a much more pleasant way to train, I think.
Sean Heisen, our guest, training director for Men's Fitness and Muscle and Fitness magazine. Sean, what is the proper time between sets do you suggest?
It really depends on the exercise. If you're doing an exercise that requires a lot of muscles, like a squat or a bench press, it's very fatiguing. You might want to rest 90 seconds up to 2 or 3 minutes. If it's an isolation exercise, like a bicep curl or a leg extension, it's a relatively easy exercise. There's not a big metabolic or central nervous system demand with that. You can rest only about 30 seconds to 60 seconds. You don't need much more than that.
Sean, can you just, we're a little bit short on time, but would really be interested to know, what does a workout look like, So, here I am, 50-year-old guy, I have an hour to work out, maybe 45 minutes, 3 times a week. I like to do strength, and then I got to find cardio time. So if you were advising me and my goals were, weight management and maintaining muscle mass and, nothing crazy, just basic stuff, what would it look like? What would you tell me?
Well, base your workouts around a main lift, something for upper body and lower body. You do those on different days. Find an exercise that you can physically do. If you have trouble with squats or conventional deadlifts, find a trap bar deadlift or do a different squat variation, like a goblet squat that is easier on your back or your knees if you have trouble with the conventional version.
So progressions, you're saying. So something that's a little same muscle groups but easier.
Right, and something that you can physically do and progress on, and that then you can build your routine around that lift. Make sure that if that lift is progressing, if you're getting stronger for certain squat variation, I can guarantee you your legs are going to look better, you're going to be leaner and stronger overall in a few months. Just focus on the simple stuff. And your cardio, you can get On off days, you can doesn't have to be a really structured program. Just work on being more active and let most of your fat loss come through your diet if your goal is to lose fat.
So what's the most unique aspect of your take on this, your philosophy, based on what else is going on out there?
I just think that my book cuts through all the garbage, and it gives you the bare minimum. If somebody just wants to get in shape and they only have 4 days a week to commit to it, and they don't want to, learn a ton about different exercises and take on every new fad out there at once, here's the absolute minimum. 5 exercises in a workout, 4 days of lifting a week, a diet that's all laid out for you that allows you to eat foods you want to eat and lets you eat plenty of carbs. I'm not restricting any particular food groups. You can do it. It's very, easily assimilated into a normal lifestyle.
And final question, Sean, what about staying on a nutrition plan? I know so many people go on the diets or the cleanses and things. What's the technique, and what do you suggest for staying on something?
You have to make whatever you're going to do sustainable, and that just means making it as close to the way you want to eat, the way you've grown up naturally eating as you can. And that really, for most people, is allowing them to eat carbs. There's these crazy fad diets these days that don't let you eat carbs. Well, carbs are fruit and potatoes and rice, and, guys like to eat those things, and you should be able to eat those things. It's really about calorie control. If your calories are going to go down, then your body fat's going to go down.
Well, you just made Steve's day, so this was worth it in its entirety.
I like the carbs. I try to work out, too, though. Thank you, Sean. Great stuff. Sean Hyson, our guest. Sean, SEAN-HYSON.com is the website. He is the training director for Men's Fitness and Muscle and Fitness magazines. Back with more of our show, Sports Medicine Weekly, right after these messages.
On ESPN Radio.
At ATI Physical Therapy, we're changing the way you think about physical therapy. We have just one goal at ATI, to make you feel better. And that's what we'll do. With the friendliest staff, the most vibrant clinics, and a unique treatment philosophy focused on making your time with us the highlight of your day. See how rewarding physical therapy can be. Visit ATIPT.com or stop in one of ATI's 80 Chicago area clinics. Taking physical therapy to a higher level, that's ATI. Get there.
We help gardeners keep gardening. We help runners keep running. We help golfers keep golfing. We help moms keep mothering. We help tennis players keep tennising, and you get the point. At Athletico Physical Therapy and Occupational Therapy, we help people keep doing the things they love to do. So if you have an injury or a nagging pain that's holding you back, we can help. It can all start with a simple complimentary injury screening by a physical therapist or athletic trainer who will assess your strength, range of motion, and flexibility. Following your screening, we can make a recommendation and show you stretches or exercises to help you manage your symptoms and care for your condition so you can get back doing whatever it is you love to do. To schedule your complimentary injury screening, call 1-877-ATHLETICO or go to athletico.com.
You can listen to past shows of Sports Medicine Weekly by downloading Stitcher, and you can find Stitcher on our website. Click on the Stitcher logo and listen to Sports Medicine Weekly.
Remember when playing a round of golf or shooting hoops with your buddies didn't bother your knees? It's time to get back in the game without surgery or more pain pills. Ask your doctor about the Oser Unloader 1. It's an easy-to-wear knee brace that is clinically proven to improve mobility and decrease the need for pain medication. Try it out and feel the difference when you win again. To learn more, call 877-265-2005 or visit www.oser.com/knee pain. That's OSSUR.com/knee pain.
You're listening to Sports Medicine Weekly on ESPN 1000.
Sports Medicine Weekly is being brought to you in part by ATI Physical Therapy for the highest quality care in a friendly environment. By Oser Americas, orthopedic technology for a life without limitations. By Integrated Orthopedics, accelerate your healing. By Athletico Physical Therapy and Occupational Therapy, providers of physical therapy to all Chicago professional sports teams. And by Karen Malkin Health Counseling. Transform your health one bite at a time. Well, many thanks to our producer, Peter Cohen, as well as David Cole for managing our website and all of his behind-the-scenes work. We also thank Samantha Smith from Midwest Orthopedics at Rush and another producer, Treesan Seeger, for all her terrific sales and marketing efforts. For Dr. Brian Cole, my name is Steve Kashul saying so long. Thanks again for listening to Sports Medicine Weekly here each Saturday morning at 8:30 a.m. only on ESPN 1000.
The preceding program was a paid advertisement. The views reflected are not necessarily the views of ESPN 1000.